Hi, good morning. I am Dr. Felipe A. Merano, and I'm going to teach you again the nursing care plan, how to improve your nursing care plan using Nanda. Okay, in here is one sample of the work of the students, and we will correlate this one with the Nanda. Okay, so this is the typical format of the nursing care plan. We have the assessment, diagnosis, outcome identification, planning, intervention, rationale, and evaluation. This is the latest update or format for the nursing care plan. And as you can see, based on the assessment, okay, there is subjective and objective data. Okay, for this setting is in Philippine setting, but you could use this also in any type of setting. So on the top portion is the patient name. So in this case, we put the name of the patient as patient A, and the age of the patient is 45 years old, and sex is male. And our case is cholecystitis. And this is based on surgery department. So we have here the surgical procedure for the cholecystitis, which is cholecystectomy. So that would be the case for this nursing care plan. So the student put the subjective data, which is, Sir, natatakot po ako sa operasyon ko. Magiging ayos po ba ang lahat after the operation? So this is as verbalized by the patient. And the objective data is based on observation of the nurse or nursing students is excessive sweating, okay, shaking of hands, okay, pale, yan. Then supported with vital signs, BP 130/90, pulse rate is 90 beats per minute, and respiratory rate is 32 beat per minute, and the temperature is 37.0 degrees centigrade. Okay, so as we all know that we as a nurse should define the diagnosis, and we must conceptualize this diagnosis based on the definitions of Nanda. So, based on the subjective data, we assume that the patient is having anxiety because of the operation that will be conducted to her or to him. Sorry, to him because the patient is male. Okay, so let's look on the diagnosis of anxiety as anxiety in the Nanda. I have here with you is the uh, nursing diagnosis based on Carpenito 2013. So I use this as a reference for this review or for this teaching methodology regarding the preparations for NCP. Based on the definitions of Nanda regarding anxiety, it is vague, uneasy feeling of discomfort or dread accompanied by an autonomic response. The source often unspecific or unknown to the individual. A feeling of apprehension caused by anticipation of danger. It is an alerting signal that warns of impending danger and enables the individual to take measure to deal with threat. So based on the subjective data given by the patient, it connotes about the definitions of anxiety, because in the subjective data, natatakot, there is fear of the unknown. Okay, that's why the students provide good diagnosis, which is anxiety or mild. Nilagyan niya ng, he put a mild description regarding the anxiety, and this is related to the upcoming surgery as evidenced by excessive sweating and shaking of hands. But then if you will check about the situation based on the description given by the students, this is not mild anxiety because there is a shaking of hands. Probably this is incorrect. Okay, so based on the description. Okay, so you have the right diagnosis for the patient, but the supporting characteristic for the anxiety is not appropriate for the situation. So let's look on the defining characteristic of what anxiety is. So the defining characteristic would support the objective data as basis for the patient if the patient really experienced anxiety. So let's check the defining characteristic. So in all nursing diagnosis, there is a defining characteristic. Ito po yung ating magiging basihan kung present nga ba ang anxiety sa sitwasyon ng ating pasyente. So based dun sa given ng estudyante, which is uh, uh, sweating and shaking of hands, we will check if this is really present in the Nanda defining characteristic. So nandito po ang description of the characteristic of a person having anxiety. So here is increased pulse, okay, increased respiration, diaphoresis or sweating, voice quivering, yan, palpitation, urinary frequency, hesitancy or urgency, insomnia, facial flushing and or pallor, body aches or pain, paresthesia or numbness, okay? Then increased blood pressure, pupil dilatation, and trembling and switching, nausea, diarrhea, fatigue, dry mouth, restlessness, faintness, and anorexia. So if these are present, you must select only those manifested in your patient. You should not include here what is obvious and what is observable. You must select among these defining characteristics to support your claim for anxiety. So in here, let's look the work of the student. Okay. So she only or he only write the excessive sweating, shaking of hands and pale, which is written also in the Nanda. Excessive sweating, that is diaphoresis. Okay, shivering of hand. Okay, let's look on shivering. Okay, facial, dry mouth, restlessness, trembling and twitching would be the right description. Okay, and pallor. Pallor is here. I think pallor is, here. Okay, so these are the manifestation shown by the patient, the signs and symptoms of anxiety which is present. But then you could add more to elaborate further the uh, diagnosis to support. Okay, so next, where we can get the outcome identification. So we follow the format of ADOPIE: assessment, diagnosis, outcome identification, planning, intervention, and evaluation. We also add the rationale just to support the intervention, why we have to do those intervention to the client. And now we will see, let's see the where we get the outcome identification. Let's check the Nanda. Okay. So by the way, there is also additional defining characteristic based on different situation. In emotional, the client states feeling of apprehensive. Yan. Literally, you can check all this as if these things are manifested by your client, by your patient. Then where we should get the uh, outcome identification. So let's look. These are all additional for anxiety as observable by healthcare provider or by the nurse, manifested by the patient. So there are a lot of things you could see. Then concept. Let's look the goal. Okay. Mm. So if you will see, there is also maternal consideration, geriatric consideration, and we are trying to find the objective. Okay, yan. Okay, this is the goal. Okay, describe own's anxiety and coping pattern. Okay, so we need to describe the level of coping for anxiety. This is the goal. Anxiety level, coping, and impulse self-control. So these are the outcome identification. Describe own anxiety and coping patterns and identifies two strategies to reduce anxiety. So the nurse should help the patient to describe his own anxiety and help them to identify the coping patterns. That should be the outcome identification for the patient and identify two strategies to reduce anxiety. So let's check the work of the student. Okay. So outcome identification, appear relaxed. Okay. Verbalize readiness for the surgery and reduce anxiety. So supposed to be the student should write what is written in should write these two description, and we will check if this will fit with the situation of the client. So for additional, so let's check the work of student if that will fit to the description of Nanda based on identification of uh, outcome identification. So here, describe own's anxiety and coping pattern. So the goal, the outcome should be the patient should appear relaxed. Is this one fit to the description of Nanda? Describe own. So we could describe the patient's anxiety and coping patterns if the patient appears relaxed. So this would be correct a little bit because this describe the anxiety of the patient and the coping pattern. Then verbalize readiness for the surgery. So identify two strategies and reduce that would not fit, but this will also fit to describe one's own anxiety and coping pattern. So that would be correct. Okay. Then reduce the anxiety. So uh, in here, the student are giving identifying strategies. But the most appropriate one is to write all these things on the outcome identification and remove this. But then this will also fit to the situation if you will utilize this. So for students, in order to follow the prescription of Nanda, we need to write these two as your outcome identification. Okay, then based on this, you could put this one as your plan. So in here, after 8 hours of nursing intervention, the patient will lessen anxiety for the upcoming surgery and reduce the feeling of sweating, shaking of hands, and uh, be calm. These things, this last part, will not fit to the outcome identification. So to correct all these things, okay, lessen anxiety of the upcoming reduce, and we need to write, okay, to correct this one, okay, we need to write all these things because this seems appears to be a plan. Okay, okay, because we remove this because the supporting uh, description for the diagnosis is not appropriate for the situation. Okay. Although there's shaking of hands, if we limit or if we correct the patients to appear relaxed, okay, to verbalize the feeling of readiness for surgery, all these things will be addressed and reduce anxiety. Shaking of hands and excessive sweating is uh, can be addressed by reducing the anxiety. If we address the root cause of anxiety, then these signs and symptoms of anxiety will be removed. So next, why did we put this plan in here? It is because this one will satisfy or answer the outcome identification number 1. Okay? And this also number 2 will address the outcome identification number 1, and this reduce the anxiety will address the outcome identification number 2. But you could put a lot of things here if we will look on to our nursing intervention. So there are a lot of things that we could provide based on the nursing intervention presented in the Nanda. So it's written here, nursing intervention for anxiety can apply to any client with anxiety regardless of etiology and contributing factors. So this is applicable in all cases, okay, in all types of medical or surgical cases. Okay, even the patient is experiencing anxiety. Okay, so here, if the patient is, so we need to assess the level of anxiety. Okay, mild, moderate, severe, and panic. So in here, when the patient is having anxiety, so provide reassurance and comfort. Stay with the client. Do not make any demands or ask the client to make decisions. So these are all nursing intervention, and the students will no longer be it will not be difficult for student to create the nursing intervention because it's already written. You will just get what is applicable to your client. Okay, so next, let's check the nursing intervention. Okay, establish report, that's correct. Check doctor's order, explain the procedures and care of delivered repeat as needed. Yan. Acknowledge the feeling of normalcy, feeling in this situation. Okay. So let's check if this all written. Based on the nursing intervention, it is situated on the cholecystectomy. That's why we will identify the patients in NPO, secure consent, because the patient is under admission. Okay, then laboratory examination, although this is not part of the anxiety, but then this is included in as part of the nursing management for cholecystectomy. You can add that, but then you need to arrange it according to, although you are not required to put label, but for this purpose, for proper identification of students, the first nursing intervention should be written, should all be independent nursing function. I just write this so that it will be clear for you, but it's not needed to write whether it's independent, collaborative, or dependent nursing function. Independent function, this is function. It means independent function means that the nurse can do it whether uh, even there is no doctor's order, because that is the normal functions of the nurse. Okay, then after here, okay, is the collaborative nursing function. Okay, so this collaborative nursing function, because of the laboratory examination, transfer the patient to in the ward, that is magiging po itong this will be the an independent function of the nurse. Position the patients uncomfortable. Okay, position, cut. That is independent nursing function. And administered medication is your dependent nursing function. This will be the dependent nursing function. So if you will check or look on the following, I think there is no nursing management uh, for anxiety. So to make this appropriate for the case, so you could select, yan, stay with the client. Okay. So all these things, whichever applicable, can be included in the nursing management. Okay. I just put this one for this thing so that you will properly identify what are the nursing interventions for anxiety. Okay. So I just put everything here, but when you make NCP, just follow what is appropriate and can be manageable or can be applied to your client. Okay. And you could arrange also the grammar, okay, to make it appropriate to your client or to your case. Okay. Then you could include also the rationale for each nursing intervention. So as you can see, the rationale for established rapport is to gain trust to your client. Okay. In Nanda, you will also see or identify the dependent and independent nursing function. Okay. So I will just check if there is available dependent nursing function. So, by the way, there is also a pediatric intervention if in case that your patient is pedia or children. There, there is also maternal intervention. Okay, so these are the second classification of anxiety, death anxiety. But I'm looking for the dependent nursing function about doctor's order or providing any medication if there is medication available for anxiety. Okay. So, Dinanda did not provide any dependent nursing function. Okay. Hmm. So, there is no dependent nursing function for anxiety. So, this is manageable by therapy. Okay, let's go back to the nursing care plan. Okay. So, all these things are being done by the student nurse according to the case, and these are the things taken uh, from our Nanda. Okay, you will just get only what is applicable to your client. Then the evaluation will be based on the if the outcome identification are met. So you will just focus on after 8 hours of nursing intervention, the patient describe. Okay, we can add this one. So in past form, okay, patient is lying comfortably on bed and can verbalize anxiety, is reduced to more manageable level, goal partially met. Okay, you can write it that, but it would be most appropriate if you would address the outcome identification because that is our main goal. Okay, so you could write here at the end of 8 hours, manageable level, the patient describe mm, the patient describe his own anxiety and coping pattern. Okay, next, the patient identified identified it must be on past form and describe his own anxiety. So this will be our evaluation. You can also specify the evaluation related to your plan, but it must be generalized also based on outcome identification. So as the student did, okay, he based his evaluation on the plan, but it must be appropriate to identify your evaluation based on outcome identification. And therefore, we made already one nursing care plan based on Nanda. Okay. Uh, so I hope that this lesson or this lecture will help you to go uh, in creating nursing care plan with the best systematic way using Nanda. Okay, thank you and God bless you. I am requesting you to subscribe and like and share my video so that I could improve more or provide you more lecture on creating nursing care plan. So thank you and God bless. So I will write here something to remember from your side. Please like, share, and subscribe. Thank you and God bless.